Hello, my name is Michelle Embleton, and today in this video we are going to have a look at what is IMSI technique in IVF treatments. IMSI stands for intracytoplasmic morphologically selected sperm injection and is used alongside IVF in order to increase success rates. In this video we are going to have a little look at what exactly is IMSI, when we decide to use it, and have a look at the advantages and the disadvantages of this technique. Then we will have a look at a couple of the most frequently asked questions from our users and answer them for you. The field of assisted reproduction is constantly ongoing in improving and innovating techniques with research, and a recent technique is called IMSI. This stands for intracytoplasmic morphologically selected sperm injection and is a way of choosing the very best sperm for the in vitro fertilization process. This cutting-edge technique uses ultra-high magnification levels, over 6,300 times normal levels, to study the sperm and look at their morphology closely before choosing which one will be used for fertilization. This is a great advantage over the more frequently used ICSI technique, which only uses 400 times magnification. IMSI allows the embryologist to study the sperm in great detail, and they will look at the headpiece, the neck piece, and the tail. The headpiece should be intact with an intact nucleus and of an oval shape. The tail needs to be straight and not curved. Additionally, the sperm needs to have its acrosome intact and be of a transparent color. All of these things help the sperm to properly penetrate and fertilize the egg. One of the most commonly used techniques in IVF these days is ICSI, intracytoplasmic sperm injection, in which a sperm cell is selected by the embryologist and is injected directly into the egg cell. This is done under magnification levels of about 400 times, so it is the embryologist who will select the sperm cell. By using IMSI, we can better the selection of the sperm cell. One of the drawbacks of the ICSI technique is that the embryologists themselves may have their own selective criteria for choosing a sperm cell. And the advantage of using IMSI is that we can really study the sperm cells in more detail to choose what is indeed the best sperm. As a result of IMSI, we see better success rates in terms of pregnancy and birth rates. By using such high power magnification, the specialist can actually study inside the sperm cell to check the nucleus is intact and is not broken, and that the sperm cell inside and outside is of very good quality and likely to produce good quality embryos following fertilization. When we look at male factor infertility, which can account for up to 30% of cases where couples seek fertility treatments, it can often be due to problems with the sperm themselves. If a man has a low sperm count, or perhaps has sperm with poor motility, they don't move forward progressively properly, or the sperm are of poor morphology, they don't have the correct shape and structure that a healthy sperm cell has, the IMSI technique can be very beneficial. This is especially true in cases of teratozoospermia, which is with sperm with a poor morphology. If the sperm sample presents with a great deal of abnormally shaped sperm, IMSI will allow the specialists to actually choose the best morphologically shaped sperm in order to go ahead and use for fertilization. I'd like to point out that IMSI is not a standard procedure in IVF protocols, and indeed requires your IVF center to have the necessary microscope and expertise to perform the treatment. But it is a useful technique to be used, for example, when we've had previous failures with ICSI techniques. Or, for example, we are seeing a lot of sperm DNA fragmentation. Perhaps there is implantation failure or repeated previous miscarriages. If it is a case that fertilization occurs, but then the embryos stop growing for whatever reason, it may be useful to try the IMSI technique. It is also sometimes used for couples who have had long-term unexplained infertility, where the actual reasons for the infertility may not be known, but this technique has been shown to help increase success rates for these people. Well, with any technique, there are always the pros and cons. So let's be positive and start with the advantages. The main advantages of intracytoplasmic morphologically selected sperm injection, IMSI, are that the sperm cells can be studied under very high power magnification, about 6,000 times their normal size. The study of the sperm cells is done in real time and does not need the use of any dyes in which to study the sperm, which could potentially affect their quality. This ultra-high magnification allows us to observe any potential defects there may be in the head, in the neck, in the tail, and look for things that may indicate there are problems with the sperm, such as DNA fragmentation. In general, the IMSI technique has increased pregnancy rates and decreased miscarriage rates, although this doesn't necessarily mean it will for all possible cases. Looking at the disadvantages of IMSI, the main one is the time required in which to do this. It can take up to 5 or 6 hours and 2 embryologists to look at the sperm sample in this level of detail. It is a laborious task. As such, it's going to mean an increased cost for the patient. Another disadvantage is that it's not available in all fertility centres. It requires the centre having the necessary equipment to perform the ultra-high level magnification. For these reasons, IMSI is only usually performed in cases where there is very poor quality sperm, or there have been repeated failures in previous IVF or IVF ICSI cycles. More research is needed and will be interesting to see how this technique develops in the future and how it can help progress the field of assisted reproduction. A couple of frequently asked questions from our users about IMSI are: how is IMSI performed? The MSI procedure is pretty much the same as that used for intracytoplasmic sperm injection. Once the sperm sample is collected, it is taken to the laboratory where it is processed. The sperm will be centrifuged to remove them from the semen and resuspended in another medium whereby they can be studied. This sperm sample in IMSI will then be subjected to the ultra-high power magnification. This may take between 1 and 6 hours depending on who and how they are performing the task. A digital microscope is used and there is a monitor to visualize in great detail the individual sperm. Once the sperm have been chosen, we go back to a similar process of ICSI. The sperm sample is taken to the egg cells and aspirated into a microinjection needle where it will be injected directly into the egg cell, as with a standard IVF ICSI procedure. Why is IMSI such a costly and slow procedure? It is a very laborious process and time-consuming and requires the specialists themselves to be highly trained. In fact, it often requires 2 embryologists working side by side in order to perform this treatment. As the magnification is so high, even finding the sperm cells under the microscope properly can be quite a challenging task. Obviously, the time required by highly trained specialists and the equipment needed in which to perform this all lead to an increased cost for the patient. We would like to hear about any of your experiences, so please do leave us a comment in the section below. And if you've enjoyed this video and found it informative and useful, please click like and don't forget to subscribe so you don't miss any of the future videos. And as always, I would like to leave you with a link to an article which will be in the description below. In this article, you will find more information about what I've talked about and links to other articles on other topics that may be of interest to you. Thank you.